Every time I see her, I see Melissa, because they both had big eyes. They both were very handsy. And she'll make a face every now and again that looks just like her. And I'm like, this is exactly what your sister would look like.
Infant mortality in Central Ohio is a huge issue. 145 babies died last year. Those are babies that didn't have a first birthday. You know, they were tragedies for their families.
This is my daughter, Michelle. She was a monodyed twin, but we lost her sister about a week after they were born. Her sister's name was Melissa. She ended up getting a really bad staph infection, and it ended up putting a lot of acid in her blood, which caused her heart to stop.
Most of the underlying factors for infant mortality are premature births, babies born too soon, too early, as well as congenital anomalies.
You never think this stuff could happen to you. You hear about it happening all over, you know, to different people, different diseases and stuff, but you never think it's going to happen to you.
He had autosomal recessive polycystic kidney disease. It puts cysts throughout the kidneys and just causes them not to function.
And when they don't function and don't produce the amniotic fluid, then causes, you know, the lungs can't develop because there ain't enough fluid for them to.
Infant death isn't something that we raise up the flagpole and say, I lost my child. I think it's both very personal, it's both very family oriented. Hopefully people will gather around and support families, but it's not something that's widely talked about.
In a way, when we get to talk about Maddox, for maybe just a moment, it's kind of like being there with them again. You know that you haven't forgotten him. Even though you're not physically holding him, it just lets you feel that moment again.
The Greater Columbus Infant Mortality Task Force came together because those of us in public health and in healthcare on our own weren't able to solve this problem. African Americans have a higher infant mortality rate from prematurity, from congenital anomalies, but clearly around infant sleep and sleep-related infant deaths as well. So across all of these factors, we are also looking at that racial disparity.
The data shouts out to us that relative to other states, we do not do well. I think that the first part of improving those numbers is to have an informed citizenry.
We're going to be talking about smoking cessation or how smoking can harm your baby.
Moms2Be is it's kind of a grassroots effort. We said, let's make it fun. I mean, let's try to have a healthy, happy environment for women to come where they could reduce their stress, where they could feel supported, where we could learn from them. You know, what are the issues that are impacting their lives and their pregnancy?
It gets hard when you're pregnant. A lot of people don't realize how hard it gets, especially people that haven't been through it. And this place really helps. They help make sure you're calmed down so your blood pressure doesn't get too high. If you have diabetes or have had diabetes with pregnancy, they'll help you keep control of your blood sugar. They always remind you about don't put your baby in bed with you, make sure you have the right sleeping stuff.
And we've learned there are incredible barriers. You know, incredible barriers to getting just ongoing health care for chronic diseases as well as help for the pregnancy itself.
Probably the biggest, largest, most complicated recommendation of the entire task force is to address the economic and the social aspects of where people live in their neighborhoods that drives the infant mortality and specifically the disparities among infant deaths.
Poverty rates, graduation rates, unemployment rates, high crime neighborhoods, those sort of things. All of those things actually influence one's overall health and have a significant influence on birth outcomes.
Stress is a part of it. Do everything you can for your child, everything. If you have to move out of an environment for your child, do it.
maybe ours couldn't have been helped because it was a genetic situation. But having gone through this, if there's anything that a person could do to take care of themselves, being aware of your body and the baby, if there's anything at all, you know, to avoid going through this, then, you know, do it.